Congratulations, we made it through the surgery. Everything went well, and you have your interim prosthesis. Either it's secured with the fasteners and the screws, as we said prior to the appointment, or you have your interim denture in. Either way, the next few 10 to 14 days are going to be very, very, very important. And the instructions that we give you are going to be very important that you follow those. I'd love for you to maintain and eat what you normally do, but having a soft diet. I mean, not going out and say, oh, it's time for me to have my T-bone steak or anything like that. But I want you to maintain do it as a soft diet, making sure you cut it into smaller pieces. That prosthesis is definitely secure. However, we just don't want to challenge it too much at this stage. Soft diets, at all possible, if at all possible, are absolutely a must. Staying hydrated and making sure that we give you the appliances to clean under the prosthesis, that you're using those when instructed. Normally I tell patients, don't flush underneath that appliance for the first 3 to 4 or 5 days. And to give the tissues a chance to heal, especially their extraction sites. So once we tell you, we give you the go-ahead and proceed with that, you get that water pick on your visit when you leave. We want you to make use of it. You have a little tiny space underneath that prosthesis which allows you to be able to flush it out. You can't take it out on your own, especially if it's secured in place with the implants, but you need to be able to clean underneath it on a daily basis. And you should be able to use that at least twice a day, but definitely before bedtime. Hygiene is absolutely essential. It's something that you gotta do. So please do that. Take your medications as prescribed. Typically after a surgery, depending on how extensive it is, patients can and will feel a little discomfort on the third day. On the third day, you might not like me so much. You ask questions, did I make the right decision? So having a little bit of inflammation, a little bit of swelling is not unusual at that point. Don't be alarmed. If it's something that feels really abnormal as far as pain or discomfort, or the pain is so excruciating you can't handle it, please give us a call here at the office. We want to get you in and take a look at it. But typically, if you're taking the medication that we prescribe, it should be a breeze, maybe a little mild discomfort. But I normally prescribe an anti-inflammatory and I normally prescribe antibiotics. Taking that anti-inflammatory every 4 hours. Every 4 hours, whether you feel pain or not, will help lessen the amount of post-op discomfort you have on that third day. I can't say that enough. Be sure to take the medications as we instruct them to you, even if it requires you to wake up. We want to have a good serum level of that antibiotic as well as the anti-inflammatory drug in your system, so you don't need anything heavier that's going to make you sleepy or nauseated or anything like that. We typically can avoid those medications so long as you follow the instructions and we keep our surgeries as atraumatic as possible. It's going to be a good several days getting adjusted to wearing the appliance. It's going to change your speech, as we told you in the pre-op. Your speech will be slightly affected as your brain adjusts to having this new prosthesis in place. It'll affect how you salivate. It's a foreign body. It's in your mouth and your body wants to kick it out. So you'll salivate a little bit more. Eating will be a little bit different, but all those things you will adjust to as you get accustomed to your new smile and your new way to chew and your new life. Again, if there are any questions you have or you have any majorly severe pain, we want you to call us right away. Let us know, and we'll look forward to getting you on your path to getting to your final prosthesis, which we made in a couple of weeks, depending on your level of healing and the fact that you're going to love the way you look.